Eric Hammer here, registered physiotherapist. Today I'd like to tell you a little bit about one of my favorite sort of self-mobilization exercises for thumb osteoarthritis. So essentially what arthritis is, and essentially it's one of the most common sort of conditions that you'll see in a thumb. And basically what happens is we have this joint in the thumb joint called your CMC joint, and it's essentially one of the main bones right in the meaty part, so to speak, of the thumb. And typically what will happen is this particular joint that's responsible for thumb opposition and for torsion and rotational type movements, over time the cartilage between these different bones will start to wear down, and as a result of this wearing down, so to speak, of the cartilage, you get this bone on bone, which then creates pain, swelling, discomfort, a lack of mobility essentially. And so one of my favorite exercises to do with patients that have this is called a self-traction exercise. And essentially what you do is you would actually hold on to the thumb, so let's say it's the right thumb that's affected, you would hold on to it with your opposite hand, grip it, and then do just a very, very gentle little pull in which you're offloading the joint essentially. And so what this is, it's a form of self-traction for that particular joint. What the self-traction does is it helps to mobilize the joint, helps to lubricate it, helps with pain, helps to reduce swelling. The one thing I should mention with this is you want to produce or do the least amount of effort in order to get a positive result. So you really want to be gentle and careful with this. And also, you wouldn't necessarily want to do this particular self-traction exercise if the thumb is super, super painful. It's one of those things where what we find with arthritis is pain tends to fluctuate with it. So there will be certain days, certain times where it might not even feel painful at all, and then other days or even seasons, or certain seasons for some individuals where it'll be quite painful, or it could be that there's a rainy day where there's a pressure change and somebody will feel more pain in their thumb. And so a lot of times in those particular occasions you wouldn't necessarily want to do the traction technique, because ideally you wouldn't want to provoke symptoms. The other thing too that I'll sometimes mention with this particular condition is using a wax bath beforehand, before doing that self-traction. I find that that can be really helpful in terms of warming up the joint and actually freeing up in terms of mobility before doing the traction technique. So again, you want to make sure that this exercise is appropriate for you, so making sure you talk with a physiotherapist or a doctor first of all, and also making sure again that the thumb isn't in sort of this flared up condition, because again what can happen is if you do the traction technique when there's a lot of inflammation there, you might actually inadvertently provoke your symptoms. Thanks again for watching, and have a great day. Thanks.